Well, hello and welcome to the show. I'm Katie Bayliss. As a nation, we're known for loving and caring for our pets. So much so, a recent survey by Benenden showed that nearly half of all pet owners splashed out an average of £19.50 per month on insurance. We also like to take care of our prized possessions, like cars and jewellery. But with so much time and money being spent on these things, are we forgetting about our own health and well-being? Joining me in the studio is Pam Evans, Benenden, Kent and Sussex Branch, Rick Haslam, Sales and Development Director, Screenetics UK, and Sam McKenzie, Health and Wellbeing Physiologist. Welcome, guys.
Hi.
Hi.
Well, coming up on the show today, we'll be talking about why we put our pets and possessions first, why we need to take care of ourselves, and we'll also have helpful tips on how you can get a good night's sleep. Well, firstly, Rick, Benenden's research has discovered that many of us are spending a huge amount of money on looking after our pets and our possessions, but very little action is taken when it comes to looking after ourselves and our own well-being. What do you think about the research?
Well, it doesn't surprise me. Obviously, there are issues out there that people sort of struggle with in terms of their own health and well-being, and they can obviously then see their pets or their possessions and they can relate more easily to those with potentially something that's inside which is harder to understand. However, we do have this issue that we're all living longer. Stats are showing that we are living longer, but at the same time we're not taking enough exercise. We don't really know our health biometrics or our key numbers such as blood pressure, cholesterol, activity levels, and so potentially there's a risk going forward that whilst we are looking after our loved prized possessions, we're not looking after ourselves properly, and there are easy ways to do that.
Absolutely. So, you know, what can happen if we don't invest that time and I guess money, energy into our own health and well-being?
Well, I think it's related to our quality of life. The reason we look after our pets in our homes is to make sure that they're protected and secure in the future. It's exactly the same with our own health and well-being. If we don't look after our cholesterol levels or our activity levels or our nutrition, potentially our quality of life drops down. We have less energy. We are less engaged in our society, whether that's our family or our friends. Potentially we don't have that joie de vivre, I suppose, in terms of, you know, maximising our performance. I like to talk about performance and engagement within the way I live my life, and if I'm active and I'm eating well, I know I'm performing to the best of my ability.
And I guess the pets and possessions won't be much use to us if we're not looking after our health as well. So how can we, I guess, address easily and simply that imbalance that many of us seem to have of looking after other things before we look after ourselves?
And I think that's where Benenden come in, because obviously there is this focus on individuals' health and well-being, as well as pets, as well as home, etc. But Benenden have come up with some new products and solutions to enable us to look after our health more effectively. There's obviously the time issues and there's obviously the unknowns, but if we are more aware about our key numbers, our cholesterol or our activity levels, we can potentially then start to live a healthier lifestyle. So the tools are there, it's just making sure that we're aware of those tools. For example, Benenden have just launched a new health assessment product, which I think Pam's, you know, taken part in, and I think has been really beneficial for Pam.
Pam, as Rick said there, you've used Benenden's health assessment service. How does that work? Can you tell us a bit about your experience with it?
Yes, I took the online survey first. Just out of interest, I think it's going to come up, you know, really good, and then it sort of starts talking about BMI index, and you start thinking maybe this is not as good as it should be, and then a little later they advertised the health assessment scheme, and they were offering a deal with BMI, and I thought, but I know Benenden, I know they're a good organisation, a trusted organisation. I had looked at doing health assessments with other companies, but I wasn't sure about them. I'd heard stories about the scaremongering with them, and I didn't really want to go down that path. And I also looked at the cost, which were, you know, significantly higher than what Benenden were offering. So I booked myself in for not the top of the range, one below the top of the range health assessment, and it proved very useful to me. It found a few things that were wrong in my blood, if you like, and also at the time I was going through a major problem with abdominal pains, and I wasn't getting any resolution with the NHS and my GP. And when I went and had the health assessment, the consultant I saw knew I was worried because I'd lost 12 pounds in 12 days and I didn't know why. And she arranged for me to see a consultant at that hospital. She did the referral letter, she'd booked the appointment, and it all worked, it all tied in very well. It wasn't something I'd expected, but it worked very well for me. So I'm very grateful. And as a result of the health assessment, my GP, with my agreement, has had all the results. And she's now monitoring 1 or 2 issues in my blood that were picked up from the blood tests.
So I guess you must feel very grateful, or
absolutely,
that you actually did this, because as
and
you
I've been telling everybody ever since that they need to go and have one done, because there's things, underlying things that you don't know are wrong, or that can be resolved quite easily by having an assessment done.
Absolutely. Rick, there seems to be a bit of stigma around people getting health checks with their GPs. Why do you think that is?
Well, I think it's related to time. I think, Sam, can I bring you in on this one? Because I think Sam's at the coalface and talks a lot to the individuals who attend the health assessments.
Absolutely, and I think it's a really good point. Something that I've found, especially with working with a lot of clients, is that they mention that they're a little bit worried about possibly wasting the GP's time or possibly putting pressure on the NHS resources. And one question that I always ask is, should we only seek healthcare advice when we're ill? And I think that as a result of that, I think it's all about raising awareness through health education and putting preventative measures in place for one to measure the health.
Because I guess the discussion at the moment around NHS is that actually if we had more preventative sort of treatment going on, and that if we actually went in before we actually were ill, it would actually be the better way of doing things. It's the better way round, isn't it?
Yeah. Absolutely, and I think it's that understanding of knowing your own health. And as Pam said, if you go onto the online health risk assessment and understand that your key risks are maybe do some activity, reduce a little bit of the alcohol intake and eat a bit more fruit and vegetables. I mean, some of our stats show that of the Benenden membership at the moment, 44% don't eat 5 fruit and vegetables a day. So that, you know, we're all quite an educated society, but still we're not understanding. If we have that knowledge, we can then start to make some preventative measures, which ultimately takes the pressure away from the NHS. So you don't have to go and see the doctor if you're keeping your... It's a bit like servicing your car. If you service your car more regularly, you don't have to have an emergency repair on brake pads, etc. It's the same concept. Let's just get a little bit more ownership of our health.
You brought in some statistics there as well, Rick. Just to bring in a few more that I've got here, the research showing that 50% of men and more than 60% of women haven't been to their GP in the past 5 years. Sam, why do you think that is? I guess it's we've talked about the stigma perhaps, or feeling that you don't want to waste people's time, but could it also be a case of there's nothing wrong with me, I don't need to do anything? Is that sort of an experience that you see?
Yeah, again, I think it comes back to the point that if people don't notice any symptoms or they don't notice anything that's preventing them from doing their normal day-to-day life and activities, that's one preventative. But I think, again, some people don't want to bother the GP, and some people, you know, will wait until the very last moment until things become a real problem before they do that. And I think it's, you know, all about that prevention better than cure. It's
also about getting an appointment when you want it. I mean, I'm lucky, my GP do annual health checks, but they're 10 minutes. So with the nurse, I had 2 hours.
Can't check a lot in that time,
I
imagine.
I had 2 hours, you know, and there's a big difference. I mean, yes, you do just the basic tests, your weight, you know, your blood pressure, they take a bit of blood, they don't even do a urine test, you know, but it's just a very basic, you know, but you know, it's a start, I suppose, you know.
Yeah, and the thing is, it's that behavioural change. Yeah. Once you know your health status, you can then think, well, I should drink a bit more water, or I should go and take the dog for a walk, because that's going to reduce my future health risks. The other issue is there's less GPs per 1,000 in our population now. Over the last 5 years, there was a lot more GPs per 1,000 population. So, you know, it is hard. It's like Pam was saying, it's harder to find an appointment because you might have to go and see somebody at 3 o'clock in 2 weeks' time, whereas you could just quite effectively go online, complete a health risk assessment, understand your key risks, and then make the decision, now do I now need to do a bit of a deeper dive into a health assessment? Not a 10-minute health assessment with a GP where you're feeling a bit pressured, but actually a proper health assessment with a physiologist who can spend time and start to build a 12-month plan on what you need to do. Absolutely,
and I think we've touched on a few of those reasons why people perhaps avoid health checks or don't go. Another reason as well, I imagine, is to do with fear. A lot of people perhaps don't want to know. It's quite a big thing to go and have a full assessment and think, what could be wrong with me? Is that an issue as well, do you think? Something that
certainly
people
for
perhaps
men
are scared?
Yeah.
Or they think there isn't anything wrong with them, so why do I need one?
And our stats show that 64% of females complete these tests, and conversely, you know, the males are a lower percentage. Men do struggle about understanding the health risks, but the stats are clearly there. Waist circumference sizes have increased by, I think it's 10 or 15% over the last 10 years for males. Now, that's related to potentially our nutritional intake or our activities. So the risks are growing, but the men are almost in denial. Whereas it's quite easy for us to do an online assessment to understand the risk, or it is quite easy then to, through our own sort of comfort, know that if there is a potential risk, I'm not wasting people's time. I am potentially stopping a future risk by going and having a 30-minute health assessment through Benenden. It's great.
Absolutely, and you've touched there on sort of men perhaps being a bit more fearful than women. Also touched on, I guess, these growing waistlines and I guess the obesity issue. Do you think, Sam, perhaps now more than ever, it's sort of more important for people to be doing these checks, because so many of, I guess, the illnesses that people are facing these days are lifestyle based and can easily be rectified?
Absolutely, and I think that it's not just a case of seeking treatment, it's about improving health education to try and combat some of these issues. And just to echo some of the things that Rick was saying there, we do specialise in the health education aspect rather than just instruction, and it's about putting the science to practice, which informs the subsequent advice we can give, and as well as translating sometimes the quite complex science into quite pragmatic steps that people can put into the day-to-day lives.
So just touching on those, the health check again, just I guess to give the viewers an understanding of how they work, what's the typical things that you'll be testing for, or how the patient or the person that comes in actually is tested?
So we can test a range of things. So a lot of the things that we can look at are biometrics. So we're looking at cholesterol levels, blood pressure. We can look at blood sugars. We can look at a test called HbA1c, which looks at blood sugar levels of up to the last 3 months. And then some other body composition measurements as well. So not just BMI, we get a look at kind of what the body is made up of in terms of composition measurements, waist circumference, we can measure body fat percentage, and all these wide, varied and in-depth range of tests really do have a positive impact on the quality of the advice that we can give afterwards.
Absolutely. Pam, you obviously had the experience. You would have gone into a few of those tests as well?
Oh yes, you spend an hour with the nurse and they do all the samples, the blood, the urine, you say the BMI, ECG, which I'd never had before. So that was quite interesting. And the same type of equipment is used to measure your body fat. What else do they do? Oh, they did a hearing test, an eyesight test. It was, it was really quite rigorous. I mean, the whole thing. And then when you get to see the GP, she follows on with doing a full body examination and talks you through, issues you might have concerned about, and it really is. It's a full-on 2 hours, and I came out thinking, gosh, what's she going to find?
And I think the great thing is, there's a whole range within the Benenden health assessment, starting from £89 all the way up to the more rigorous time where you're spending time with a doctor. Sure. And so people have the choice to understand how they can improve their health risks and ultimately improve that quality of life, improve that energy, that performance that we talked about at the start.
Absolutely, and I suppose once you've had that test and there might be a few issues, some of them perhaps easily rectified if it's just a health and lifestyle thing. So let's have a look at, or let's talk about some of your top tips for maintaining or improving your health. I guess, Sam, you're the one to talk about this in terms of if somebody came to you, perhaps had a few issues that you suspected could actually be fixed easily. How do we get healthy?
Okay, so my specialist area is within nutrition and general health physiology, but I think one really important thing to mention is differentiating between general recommendation and individual requirement. It's all about getting that bespoke information for the individual, which a lot of the tests that we do inform. And I think some general top tips would be, number one, is to definitely looking at food labels. It's all about that health education, looking at and realising what type of food that you're putting into your body. Dr. Azim Malhotra at Croydon University made a great point at highlighting that it's when people buy a product, they sometimes buy a product based on the way that it's marketed rather than its actual nutritional content, and I think that's really important. So, you know, when we're looking at foods, it should be looking at balanced, wholesome foods rather than foods that might just be made up of refined sugar, for example. So it's really important to make sure that is not a main ingredient.
I guess it's quite confusing as now for a lot of people. There's a lot of sort of differing health messaging out there. We hear a lot about sugar and things like that at the moment. I guess it's getting back to basics in a way. Sometimes it's better just to sort of go back to what we used to do.
Absolutely, and you know, I think it's really about getting the simple messages across where we can do the background work within the science and really give them pragmatic advice. And just a couple of more tips. I think it's really important with exercise to focus on that, because the Department of Health recommend that most healthy adults should aim for 2.5 hours of moderate aerobic activity as well as resistance exercise. But I think not everybody's at that level. Some are exceeding it and some are below that level. But I think the main focus is getting improvement and progression for all. And then the last couple of points is to plan. Plan forward. What you're going to eat the following week, where's your exercise going to come in? And I think that by planning, it's really, well, a lot easier and a lot more realistic to plan it in at your busiest time. And sleep, the last one, is really important. Most adults need at least 7 to 8 hours sleep. One thing it definitely does is helps with recovery, but another thing is that if you're getting a lack of sleep, it interferes with your hunger combating hormones. So it's a real big one for weight management as well. And I think, again, it all links into keeping things in moderation. You can still enjoy a treat, something that's sustainable, in that if you are going to put something in place, that it is for the long haul. And then I think generally it's just about putting these things in place, enjoying your life and still being social, but being health aware. And people can get a little bit more information about that at the Benenden website.
Fantastic. It's all about balance, I suppose. But I'm just going to ask one further question, because we did say we'd touch on it a little bit. Something that I saw Pam perhaps frown a bit at when we talked about sleep. I know I certainly don't get anywhere near that amount of sleep every night. I'm, you know, perhaps awake worrying about things or thinking about work the next day. How do you get a good night's sleep? And in this day and age, when there's just so much going on, so much technology, it's so hard to switch off. Have you got any good tips for myself and the viewers?
Yeah, well, I think it's that understanding. I mean, when people go to sleep for potentially 8 hours, are they getting a good 8 hours recovery, or are they sat down and put the phone next to them before they go to bed and use the phone for an alarm, which subconsciously makes you more alert during the night time?
I do that.
Do you have a hot bath before you go to bed to relax? Potentially that increases circulation and doesn't put yourself into a sort of a peaceful mode. And the lighting, you know, reduce the lighting for a few hours before you go to bed, just to try and get your body ready for that sleep. So there's lots of tips, and within the health assessments we talk all about those tips and habits to improve your sleep, because as Sam said, if you don't recover, your body won't then make the right sort of
prepare itself.
Yeah, prepare itself for the next day's challenges. And we all have challenges, we all have stresses. But if we get that sleep right, it's easier then to eat and to perform better the next day.
And we've also got ways of monitoring these things as well in some of the services that we provide in terms of monitoring people's sleep with some of the services. So that's really good in terms of looking at these things and how we can improve it.
Pam, you look quite interested in the sleep chat. Was it something that came up in your assessment?
Yeah, I do have a problem, because no matter what time I go to bed, I still wake up at the same time. So, you know, if I go to bed late at night thinking, oh, I'll have a lie in, I still wake up sort of 7:15, that sort of time. Whereas when I worked, I mean, it is a half an hour later than when I used to work. I was up at 6:30. But yeah, I do find it difficult to get a long night's sleep. The only time I ever do get good sleep is on holiday.
Yes, I wish I could go on holiday every day. I'm sure I would sleep all the time. Absolutely.
Yeah, I don't know what I mean, I don't need to be worrying about work anymore, but you've got other things going on in your mind, I think. But it is trying to totally switch off. I've tried not having a drink an hour before I go to bed, because they say tea, coffee is bad for you. But you sort of tend to forget. You suddenly think, oh, I need a cup of tea to go to bed, and you take a cup of tea to bed with you. Like I say, you have the mobile phone on one side, and in the middle of the night you heard a ping because an email's come in, and you, although you don't wake up for it, your conscious is there. But I need to take on board some of these things these guys have been saying about, you know, removing the mobile phone. You know,
there's some simple
tips.
That
yeah,
we
absolutely.
can do.
Yeah,
and it's just a bit of lifestyle change can make a massive difference to your lifestyle.
Absolutely. Sleep, diet and exercise. I'll be looking at that, I think, from now on. Well, we've run out of time. My thanks to Pamela Evans, Rick Haslam and Sam McKenzie. If you want to find out more about what you can do to keep your health and well-being in check, go to benedenhealthassessments.co.uk. Thanks for joining us and goodbye.